seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and Ed and Noah are running the studio tonight. They are fantastic, so if you call us, tell Ed and Noah hello. They're responsible for running a great show and a great station at WOR tonight. There's more news. Just this week in the Wall Street Journal was published an article that's probably important to every woman. What is it? Well, the headline speaks for itself. Routine pelvic exam isn't helpful, report says. And in an article by Angela Chen in the Wall Street Journal this week, healthy women don't need regular pelvic exams. So it's probably a big relief for most women. Who says this? The American College of Physicians, in a new set of guidelines just released this past week. It's a professional group that made its recommendation. They examined studies from 1946 to 2014 that looked at the effectiveness of pelvic exams. So pelvic exams is obviously doing a vaginal exam, palpating the uterus, palpating the ovaries, the cervix. Usually part of that is rectal vaginal, so there's one finger in the rectum, one in the vagina with the hand on top of the abdomen. The Dr. Molly Cook said, "We found that the exam is not particularly good at detecting important disease such as early ovarian cancer, and it can fool a physician into thinking she has detected an abnormality that, once you notice, will require further investigations." The guidelines were published in the Annals of Internal Medicine. The physician group represents internists who specialize in diagnosing and treating adult diseases. Now, of course, you could say the gynecologists are probably scrambling, and yeah, they are scrambling. The American College of Obstetrics and Gynecologists, which represents doctors of gynecology and obstetrics, said that women should consult with their health care providers about having a pelvic exam. They said, and they agreed, that the pelvic exam is not evidence-based, which means there's not evidence to support its use. Now, listen, we're not talking about pap smears. Pap smears, while a part of pelvic exams, pap smears are advised. Everyone agrees with pap smears, and the importance of pap smears is to detecting cervical precancers and cancers early on, before they become invasive, before they can spread and be fatal. So the pap smear, a screening test for cervix cancer, needs to be done. We're not talking about pap smears, so if you think the two are the same, they're not really the same, although they're usually done at the same time. Pelvic exams can be uncomfortable, and many women do not like pelvic exams. The gynecologist said that they can pick up abnormalities, and it's important to have the pelvic exam. So a little bit of dispute. I think it's hard to dispute the data, and the data says that not much is learned by getting a routine pelvic exam, but you still need the pap smear. So please get your pap smears no matter what you do with the pelvic exam, and be healthy. Be healthy. So I want to talk about some other cases tonight, and interesting cases. We had a gentleman come in, Spanish-speaking gentleman, who came in with his family last week. Now, he had been diagnosed in a hospital in the 5 boroughs, kidney cancer that had already spread to the lymph nodes. So in that hospital, they did a needle biopsy of the lymph node. They showed it had spread, but nevertheless, they removed his kidney and that lymph node, or tried to anyway. Then he went to a big cancer hospital, and he's been on 4 different clinical protocols. Now, what is a clinical protocol? Some people talk about, oh, I'm so lucky I'm on a clinical protocol. Well, are you or aren't you? Most clinical protocols, not everyone, but most clinical protocols are unproven treatment. They're attempts by the doctors and the drug companies to put together a program to offer treatment to patients in a scientific way to see if this particular concoction or group of concoctions works. So usually a clinical protocol doesn't mean that it's proven, that it's the best treatment out there. It may be a new treatment that is totally unproven. So this man had 4 clinical protocols in the last year, and he never had a PET scan. He came to us because he was tired of the complications. He was tired of the progression of the cancer, and they never even did a PET scan to fully stage him up to see exactly where the cancer was in a year. He came to us. We got a complete history, and we have plenty of Spanish speakers and other speakers, Farsi and Italian and French and Russian, others in our department. We got a history, we got his documents, we got the pathology, and we got a new PET CT scan to find out exactly where the cancer is. And shocking to the patient, it was in places that he had never been told about in this big cancer hospital. Sometimes you wonder if they don't get the most sensitive test because they want to give more chemotherapy. Is that possible? I think it is possible. We like to get the most sensitive test to know exactly where the cancer is. We like to give images to the patient and the report to the patient, so the patient and the family are full participants. As I say, you're the President of the United States of your body. Not only full participants, you're in charge. We as doctors are only your advisor. We're your advisor. So all this information was given in Spanish and English to the patient and his wife and his son. And after he thought about it for a few days, he decided no more clinical protocols. He wants effective treatment. Kidney cancer, we actually just put together a paper showing kidney cancer spread to the lung. Where we treat, we have a 97% chance of stopping, shrinking, or making that cancer go away for the rest of the life of the patient. So radiosurgery is very effective. What is radiosurgery? Well, it's a misnomer, and I know we have one patient out there who doesn't even like the word. She says we should use radio zapping or radio beaming, because radiosurgery is not invasive. There's no cutting, no bleeding. With computerized guidance and a specialized team, and that's what we have at Radiosurgery New York. That's why it's our name, Radiosurgery New York. We can focus in, hit the cancer non-invasively. It's all outpatient, so you don't sleep with us, you go home. Each treatment takes about 15 minutes. You walk in, we find the cancer, we hit the cancer, you get up and go to lunch or go to the movies or go to Broadway. Anything but sleeping over. We think that you don't want to sleep in the hospital. You want to be an outpatient, you want to get better, and you want to have a good chance of getting better. So for this man, it's bye-bye clinical protocol, bye-bye cancer hospital, hopefully bye-bye bad news, and hopefully it's hello radiosurgery for kidney cancer. And by the way, for many, many years, kidney cancer and melanoma and sarcoma were considered radio-resistant cancers, where radiation didn't work. And many people falsely still believe that. Well, why is it? Why does radiosurgery work in our hands, whereas radiation was thought to be ineffective for kidney cancers, melanoma, sarcomas, and others in other people's hands? Well, it all has to do with radiobiology. What's radiobiology? It's a study of how radiation beams affect the cancer in cells, and we know if we can focus the beam, we can increase the intensity, we can avoid harm to healthy tissues, we have a much higher effectiveness ratio, something called the dose-response curve. So we give a higher dose, the response rate jumps up, and in fact those former radio-resistant cancers are now among the most sensitive in our hands, and we treat many, many patients with kidney cancer, sarcoma, melanoma, and even others that are relatively resistant, like lung cancer and colon cancer, because radiosurgery in general works so well. Nothing's perfect. We're the first to admit that. We want to be straight with everyone, but I'd rather have a 90% success than a 20% success. And in many diseases, that's the difference of radiosurgery. Just this afternoon, we had a call from a gentleman, had an English accent, had a daughter living in Colorado. She flew out to the East Coast for multiple cancer surgeries for sarcoma on her back, and she's already been told they're not going to work. You have to wonder, why is she coming out for surgery that's not going to work, where she could learn about radiosurgery, a non-invasive method of treatment with a 90% success rate. So the father is getting our information. He's going to call our office in the morning. We're going to mail one to him. We're going to mail one to his daughter in Colorado so that they can learn more about radiosurgery for sarcoma and hopefully avoid invasion, anesthesia, hospitalization, and the convalescence of surgery, which so often we believe it's not necessary. So thank God he heard our program on WOR early morning. We have two shows early morning, Sunday morning. One is 1:30 to 2:30 a.m. and one is 3 to 4 a.m. And then, of course, we have our 6 to 7 a.m. show on WOR. So he learned a lot about it, and he's going to learn more, and hopefully we'll meet his daughter. If we can help her, we certainly want to do so. We're going to stop for a little break. Again, this is Dr. Lederman from Radiosurgery New York. We have our offices at 1384 Broadway. We have booklets and DVDs that we send out to you at no charge if you call our office during the week, Monday through Friday, 9 to 5. If you have cancer or suspected cancer, it's really best to call and make an appointment. We promise if you wish to see you within one business day, we have something called the Urgent Cancer Consultants, where we would rather work more so you don't have to have sleepless nights wondering, is that lump a lump of cancer, or what should be my next step in the treatment, especially if your treatment isn't working or if your treatment isn't tolerated. So we believe you should give yourself the most chances. We believe you should give yourself the most choices by calling 212-CHOICES. And by the way, we accept most insurances, Medicare, Medicaid. So our goal is to provide information to you, to have a healthier life, a better life, and better treatment. At that point, we're going to stop for just a moment, hear from our sponsor, and we'll be right back. Thank you.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
WOR, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil